postural drainage and chest percussion. Part 1. Introductions. Objective of this video. After finish this lesson, students are able to 1. Explain the method of postural drainage and chest percussion. 2. Reverse demonstrate the method of postural drainage and chest percussion. Objectives of postural drainage and chest percussion. 1. To move the mucus and excrete from the bronchi easily. 2. To clear the airways and ventilation effectively. 3. To prevent atelectasis and pneumonia from mucus retention. Part 2. Indications and contraindications for chest physiotherapy. Indications. 1. Pediatric patients with mucus more than 30 ml per day. 2. Pediatric patients with bronchiolitis, asthma. 3. Pediatric patients with ineffective cough. 4. Pediatric patients with pneumonia, bronchial aneurysms, cystic fibrosis. 5. Pediatric patients who have to stay in bed for a long time, such as post-operation patients. Contraindications. 1. Tension pneumothorax. 2. Hemoptysis. 3. After milk or food feeding less than 2 hours. Part 3. Nursing procedure. 1. Wash the hands thoroughly to prevent infections. 2. Prepare equipment such as a towel and stethoscope. 3. Explain the pediatric patients and their caregivers for cooperation. 4. Assess the locations of mucus obstructions by auscultating the lung sounds with a stethoscope. For example, in the pediatric patient who found to have mucus obstructions at the apical segment of upper lobe of the lung, the first port will be arranged for postural drainage and chest percussion. 5. Positions the patient according to postural drainage, which is a way to use gravity to drain mucus out of the bronchial to the central airway easily. When applying postural drainage along with lung percussion or vibration, mucus in the bronchial will flow out to the trachea and is effectively expelled by crushing or suctioning. 6. Chest percussion. Use the palm to make a cup-like arch with all fingers are close together, or a cupped hand percusses on the chest wall according to the position of the lungs with mucus. Each pause of percussion lasts 1 to 3 minutes or longer if there is a loss of mucus and alternating with chest vibrations. 7th. Chest vibrations. Place the palms flat and lightly press on the chest wall by contracting the forearm and shoulder muscles. Move the palms rapidly in a vibrating manner on the area of mucus to allow the mucus to easily remove from the bronchial wall. This is done while exhaling to let the mucus loose and fall out of the trachea. In infants, assistive device may be used as periodically observe the breathing patterns of the pediatric patients to assess for hypoxia. 9th. In auditory, after lung percussions, have the child inhale slowly and deeply. Deep breathing exercise. 10th. Encourage pediatric patients to cough effectively by using the principle of deep breathing. Have the patients take a slow full breath. Hold it for a moment to increase the pressure in the chest, and then cough out vigorously and quickly. Increased intrathoracic pressure will make the mucus easier to be expelled. 11. Repeat if the mucus is not completely discharged. 12. In young children or older children who are unable to cough up the mucus by themselves, use the suctions. 13. After the chest percussions, arrange the patient in a comfortable position for rest. 14. Assess vital signs, especially the respirations, to assess changes in symptoms. 15. Record information in a nurse note. Part 4. Positions for postural damage and chest percussions. Positions on the left lung. First pose. Apical segment of upper lobe of the lung. Place the child in a seated position with the body tilted back 30 degrees. Percuss the upper left lung between the clavicle and scapula. Second pose. Posterior segment of upper lobe of the lung. Have the child to sit and lean forward 30 degrees. Percuss the left lung above to scapula between the shoulder and the cervical spine. Third pose. Anterior segment of upper lobe of the lung. Arrange a supine position with slightly to the right side. Percuss the left lung at above the nipple area and slightly below the clavicle or between the second and fourth ribs. Fourth pose. Middle part of the lung. Position to lie on left side with head 15 degrees lower. Percuss the left lung at left chest position, almost to the side of the thoracic ribs. Fifth pose. Anterior basal of lower lobe of the lung. Position to lie on the right side with semi-prone and head 30 degrees lower. Use the hand to support the left rib cage or slightly face up. Clap on the left lung at the side of the rib cage to the front and slightly lower than the nipple area. Sixth pose. Lateral basal of lower lobe of the lung. Position to lie on the right side, with semi-prone and head 30 degrees lower. Percuss the left lung at the left side of the lip cage to the 8th lip or under the armpit. 7th pose. Posterior basal of lower lobe of the lung. Arrange upon position. Head 30 degrees lower. Percuss the left lung on the back under the scapula in the same level with the lip cage or the 11 to 12 lips. Position on the right lung for postural drainage in pediatric patients. In the case of mucus is in the right lung. Arrange the position as prior mentioned, but switch from the left to the right side.